Sharma, consultant gynecologist, laparoscopic surgeon and infertility specialist at Delhi. So today we will be talking about IUI versus IVF. IUI, as we all know, is a simpler procedure as compared to IVF. IVF is commonly known as test tube baby treatment and IUI is intrauterine insemination. So today we will be discussing what are the differences between IUI and IVF, what is the difference if we pertain to patients, when can we plan IUI cycle, when it is contraindicated to go for IUI, and when do we need to directly go for IVF. So coming to IUI procedure as such, it is a very simple procedure, completely painless, and if we compare the cost involved, it is 1/10 to the cost of the IVF, and IUI is also, it requires lesser visits to the clinic, it is less invasive also. But when do we need to go for IVF if we have a solution of IUI? So I'll tell you the cases where we can plan a IUI cycle is only in the cases where both the tubes or either of the tubes of the female partner are open. The cases where both the tubes are actually blocked, then we cannot plan IUI cycle. In such cases, we have to definitely go for IVF. So if you are having infertility in which the tubes are open, the cause of infertility is somewhat else. It can be related to eggs, it can be related to moderate or mild derangements in the semen parameters, or it can be unexplained infertility. So in these cases, you can definitely plan a IUI cycle. Because when we look at the Indian scenario, IUI is much cheaper, is less invasive as compared to IVF. Though there are recommendations by the Western countries and Western associations which says that you should directly go for IVF in cases of unexplained infertility or severe endometriosis, but those recommendations are meant for the foreign countries or the Western countries because they have the infertility covered under insurance. They have it covered under national health insurance. So the cost doesn't matter to them if they go for IUI or if they go for IVF. They have the IVF cycle is completely free for them. But if we talk about Indian scenario where the infertility is not covered under insurance and you have to completely pay for the cost of it, I would say IUI is a much cheaper and very simple procedure as compared to IVF. The only requirement for IUI is that the tubes should be open. Either of the tubes, if any of those tubes, both the tubes, if any one is open, then we can plan for IUI cycle in such cases. The indications where IUI is beneficial is in cases where the semen parameters are mildly deranged. There are somewhat, we can say the counts are slightly lower, or in the cases where the motility of the sperms is slightly lower, not very deranged, then in such cases IUI has a very good role. It is really beneficial in the cases where semen parameters are just mild to moderately deranged, and also in cases where there is some problem with the egg formation or an ovulation and you have already tried for the medicines which lead to egg formation, even then the pregnancy is not occurring, you have undergone multiple cycles of ovulation induction, even then this pregnancy is not happening. In such cases, IUI is really beneficial. We call them as cervical factor, the causes of infertility. As we all know, cervix is the mouth of the uterus and there is some mucus present at the mouth in the cervix. So in rarely, in some of the cases, what happens, in small percentage of the cases of infertility, that cervical mucus has some negative effect on the motility and the life of the sperms. So when the sperms or the semen is being deposited in the vagina, the sperms are not able to reach up to the uterus, or whatever the sperms are able to reach up to the uterus or the tubes, they are not able to fertilize the eggs. That we call as cervical factor infertility. So in such cases, IUI has a very good result, because when we are doing a procedure of IUI, we are in fact bypassing that cervical mucus. We are just washing the semen, and we are just putting it directly inside the uterus through the very small tubing is there. So it is not very painful. There is no injection, nothing is there. Very small fine tubing is passed through the mouth of the uterus, and the whole washed semen is deposited inside the uterus. So whatever negative effect of the cervical mucus was there on the sperms, now it's not there. So all those sperms are now available for fertilizing the eggs, and thereby the chances of fertilization increases, the chances of normal spontaneous conception after that increases. So in such cases, you don't need to undergo a much invasive or much costlier, or we can say where you have to go for so many injections and all those things. You no need to go for IVF in such cases. To start with, at least you can definitely try a few cycles of IUI, 1, 2, 3 maybe, and I would say it usually gives a very good result. If we look at it, cumulative success rate of 3 cycles of IUI, it is quite good. We can say it up to 60 to 70% if it is nicely planned, and if it is combined with superovulation. Superovulation is a process where we are giving injections or medicines which leads to formation of more than one number of eggs. As we already know, normally one egg is formed in one cycle in a female. So the whatever probability is there with one egg, in the superovulation cycle we give some medicines or injections which help in making more than one egg in one cycle. So these may be 2, these may be 3. We try not to make more than that, because if there are 3, 4 or more than that eggs are there, we need to abandon that cycle, because that will lead to multiple births. And we try to avoid multiple births, because we already know more than twins, up till twins it's okay, but triplets, quadruplets, though that is a really very high risk pregnancy. So we try to make 2 or 3 eggs in superovulation cycles, so that the probability of the pregnancy also increases. So this way it is better than a natural conception, natural trial cycle. So it is better than that, and it is also less invasive. You just need to come to the clinic on the day of ovulation, whenever the trigger is planned accordingly. You come to the center, you get the semen, your husband given the semen sample, and then the person it is prepared in the lab, and once the semen wash is done, then that can be put directly into the uterus through a very small tubing. No painkiller is needed, no anesthesia is needed. It is a very I would say hardly a non-invasive sort of a procedure. So after that, within half an hour you can go back. You can continue with your daily routine. No need for bed rest, no need to avoid any too much of avoiding any walking or movement, no need for a complete bed rest, nothing that sort of. So you can definitely go for IUI cycle without much disturbance in your daily routine or your work or your profile, whatever you are doing. While when you have to go for IVF, we already know it is a tedious process, it is more costly also, it is more invasive also if we compare it to IUI. So IVF is specifically meant for those people in whom the tubes are not working. If in any testing like HSG or SSG or laparoscopy, it has been found that both the tubes are not working, then IUI is not an option in such cases. Then we need to definitely plan for IVF. And if I explain the procedure of IVF to you, it is also not that invasive a procedure nowadays, because we have very fixed protocols, we have very clearly demarcated guidelines how to go about it, how many clinic visits will be needed. So nowadays, majority of the times we are doing frozen embryo transfer cycles. So in these protocols, we plan egg retrieval in one cycle, and we plan embryo transfer in the another cycle. So this way, your burden of going for to the clinic or the center, which is hampering your work, it also gets halved. And also, when in the cycle where we are giving you so many injections for IVF, obviously we don't want embryo to be put in at that time, because the body is already under so much of a stress. So we plan embryo transfer in the subsequent cycle. So this way, IVF is also not very tedious nowadays, but if we compare it to IUI, it definitely is more tedious, it is more invasive, and obviously it is definitely more costly. It is costlier than IUI. So for IVF cycles, we need clear-cut demarcations of the indications. These are clearly mentioned. Both the tubes, if are blocked, then you definitely have to go for IVF. If you have already undergone 3 or more cycles of IUI, then also it is more advisable to avoid going for IUI cycle further. Instead of that, you should plan IVF in such cases. And also in cases where the semen parameters are markedly deranged, like the motility is very less, or counts are less than 5 million per ml, or morphology is very markedly deranged, then in such cases it is advisable not to waste too much of time in any of the other treatments and directly plan an IVF cycle. So there are clear-cut indications where we can go for IUI, and IUI is definitely an option if any of your tubes are working, because even if one tube is working, then also we can plan an IUI cycle by looking at which side the egg is being formed. In ultrasound, we see if your right tube is working. Then if we look in the ultrasound and we find that your egg is being formed in the right ovary, then we can definitely plan IUI cycle in that period of time. So this way, it is really very beneficial if you have not undergone any IUI cycle and any of your tubes are open. Then definitely at least try for 1 or 2 cycles, because it is less expensive, it is cheaper, it is 1/10 of the cost of the IVF, it is less invasive, it is less painful, and I would say it is completely not painful at all, and it requires very less visits to the clinic. It will not hamper your daily routine. You can continue with your work and with your job. So definitely give it a try, and obviously always you are welcome to leave your queries in the comment section. We will be delighted to reply to your queries, and I hope I was of some help in clearing in comparing the IUI and giving you an option before going for an IVF cycle. Thank you.